Thank you. Welcome everybody to the VSSNA's Town Hall number 9 for this school year. I have a few reminders before we get started. If you are a member of the press or the news media, please put your name, organization, and contact information into the chat box. Doing so allows us to follow up with you after the presentation to provide you some additional information if need be. The questions we've received that relate to the role of our guest will be posed today. You may put additional questions into the chat box and they will be added to the slide deck. Any questions that fall into the realm of public health guidance might be answered in the chat box by one of several Department of Health experts joining us for today's presentation. This session is being recorded and it will be posted to our website by the weekend. Our guest today is Dr. Daniel French, the Secretary of Education for the state of Vermont. I had last week, Friday, I was at the Secretary's advisory meeting and I brought up some concerns that you have all shared with me, and Dr. French offered to speak to you directly, and I jumped at the opportunity. I want to share a little bit of background with you about Dr. French. He earned a bachelor's degree in political science from the University of Connecticut, a master's degree in educational administration from Plymouth State University, and a doctorate in educational leadership and policy studies from the University of Vermont. Dr. French is very well versed in the public school system of the state of Vermont. His educational career includes teaching, including high school social studies in the Northeast Kingdom in Vermont public schools. In addition, he served as principal and superintendent in various parts of Vermont, and he was appointed to his current position of Secretary of Education in August of 2018. Dr. French has received numerous awards throughout his career, but as the mother of 5 active duty children, I was very touched to learn that Dr. French is an Army veteran and a graduate of the Defense Language Institute. So we are very excited to have you here, and I'll turn the mic over to you, Dr. French.
Well, thank you, and good afternoon. And I just on that same theme, I want to thank Soph for her leadership. We formed a Secretary's Advisory Group fairly early on in this emergency response, and Soph's membership on that and her participation has been significant, has added tremendous value. As I often say, school nurses have a lot of practical wisdom, and Soph has been a wonderful representative, and you should be proud to have her as your president because she's really helped us a lot in making some important decisions on our guidance. So thank you, Soph. I was scanning who was here today. I want to do a shout out to a couple of school nurses I've worked with. I want to say hello to Mandy Mayer and Megan Primo. I apologize, I don't see if I see any of the others. But just as a way of background, as Soph mentioned, you know, I was a principal for 7 years and superintendent for about 12. And then for a couple of years worked at St. Michael's College in the School Leadership Graduate Program, and then been secretary since 2018. You know, that's part of what I bring to the job a little bit. I'd like to think, particularly in the context of this emergency, is a sense of our operations as school districts, but also a sense of the regional diversity that exists across the state. Having worked about 15 years in the Northeast Kingdom, about 12 years or so in southern Vermont, and then as a consultant working statewide, and certainly as secretary, it's allowed me one of the privileges in this position, the ability to get out and travel and visit most of the schools. I'm embarrassed to say, though, I don't recognize many of the people in this meeting, so just one of the things I'll take away is when this emergency is over, I welcome the opportunity to visit your school and stop in your nurse's office and chat with you a bit. So I'll leave that as an open invitation to you and your school district. We have, as Soph mentioned, part of the invitation today was to have the opportunity to have some dialogue on specific questions And I'm certainly happy to do that. What I thought I'd do first is just provide some sort of introductory comments and observations, essentially, and not necessarily uh, prepared formal remarks in that regard. But I think one of the things I noticed pretty early on in this emergency, essentially, is that it's a huge component of it is communications and the constant sort of sense making we've all had to go through to adapt as we've gone through different steps or phases of this response. And to that end, I thought I'd sort of make some observations of what I see the situation that we're in right now, and possibly what do the next couple of months look like. In order to sort of talk about the next steps, I thought I'd just back up and look backward for a little bit. And what I've characterized in the last few weeks, I've used the phrase phases, not to be confused with steps or levels. I know we have a lot of those terms flying around the country right now in terms of the emergency, so I'll use the term phase. But really, don't hang your hat on that. It's really just a way of making sense of what I think the major transitions have been in the emergency to date in education in Vermont. So the first phase, if you will, I would argue started in March and then ended in June. And I would say this phase is what I'd call a true emergency response. A lot of the new learning as a manager, as a principal and a superintendent, I certainly had to manage my series of crises over the years, but certainly nothing at all like this. And when I say emergency response, I think, starting in March when we made the very early order and quick order to shut down all our schools, that sort of characterized the types of decisions that we were making all through the month of March and April and really up until June. And what I mean by that is, the governor implemented the state of emergency, which I believe to date is the longest state of emergency we've ever had in Vermont. And one of the things I learned, I mentioned, is that states of emergency, the statutes behind that vary greatly from state to state, but that's the context right now that we're operating our schools. The governor declared a state of emergency, and then through that delegated authority to different secretaries, like Dr. Levine, as Commissioner of Health, has unique authority, and I was delegated authority basically to create this thing called guidance, which we've all sort of become used to. But basically, the guidance that we created in this early part of the emergency functions as regulation to operate the school district in this pandemic situation. And the whole spring was a series, and you guys have been on the receiving end of that, these rapid decisions with very little consultation, really just addressing, immediate decisions that need to be made, problems, no roadmap in front of us. And I'd also observe, it's important to acknowledge we had really no understanding of the virus. We had no testing capacity. We had traditional contact tracing on the shelf and things like that, just our standard tools for addressing epidemiological emergencies, but we're running blind, other than what we observed going on in Europe and other places. And that whole phase, if you can remember back that far, I know it's hard sometimes to even think about last week, let alone 6 months ago. The transition out of phase one, this emergency response, began for me when the governor required me to promulgate graduation guidance somewhere around May 8th, somewhere in that time frame. And that was when I noticed nationally, working with my peers around the country, that school districts all started to sort of look towards the summer in particular. We're like, okay, this nightmare, this emergency is going to end. Because in education, as you know, hope springs eternal, and we always look towards the summer as a sort of a time to decompress and remediate student learning issues and so forth. And as much as that was our reflex at the time, I think we all started to acknowledge pretty quickly that the emergency was not going to end with the school year. And quickly, I think nationally, and I think also in our leadership team, we started to pivot and think about the fall and to what extent we could use the summer to prepare for the fall. And that, so to me, somewhere around June 1st begins the second phase of our emergency response, which was really 100%, maybe 150% focused on reopening schools and really addressing a series of logistical challenges, all the safety precautions, all the staffing issues. I'll throw that all into a bucket of logistics, which is now a very convenient term, but you know how complex that work is. And the guidance that came out of that, which currently is about 30 pages, is about to be 40 pages, a rather complex document. But once again, here too, in the sort of reopening phase, phase two, no roadmap in front of us. We certainly looked around the world, looked around what other states were doing, and there's no definitive model on how to reopen schools. And many of the planning documents included many other things, that you wouldn't associate in our guidance. As we have done in most of our decision making, if not all of it, is we decided to focus in on the health requirements, which I think has served us very well. And we convened a group to really focus on what are the essential health requirements to open schools safely. And I really, a shout out to our health people that are on the call today. Our Department of Health's leadership in this has been tremendous, and their ability to facilitate, to collaborate with practitioners has been just nothing short of exemplary, and has really served us so well. So as we convene this team by design, we brought health people together with educational people, and that mix between the two has led to some very dynamic collaboration, but also I think a very high quality document that on the one hand is grounded in the health science, if you will, but on the other hand is informed by the actual operational situation of our state, and also acknowledge to what extent that operational conditions, or those operational conditions, vary significantly from the kingdom to Brattleboro to Bennington to Burlington, because they do vary significantly. So phase two, I would argue, was the focus on reopening schools, which one of the reasons I started to reflect back a little bit recently was it seemed like the sole goal or the sole response that we were focused on was exclusively about reopening, and it's not. I mean, we focused on those essential underlying health issues so that we could also speak about education, which I would argue is now in the phase three that we're in, is about, okay, we're able to firstly open our schools, and I would argue we've done that successfully as a measurement of the cases we've seen, but not only open schools, but to operate them in this environment. And I would argue here too, we've been successful because we're able to, even when cases emerge now, we're able to continue to operate our schools. But the question now before us, I think to a certain extent, is this next phase, which I would argue begins, and I would say phase two ended with the transition to step three in our guidance, which occurred somewhere around September 26th. That's sort of the conclusion of the reopening phase, if you will. And now we're in this next phase, which is about how do we take what we've learned, what do we know about the virus, what do we know about the mitigation strategies, what do we know about operationalizing those mitigation strategies in the context of our school systems, how do we take what we've learned to begin to address the educational impact of the emergency on students, and that's sort of the work before us now. And it's daunting to a certain extent. But I think the other point I'd acknowledge, and I would encourage you all to acknowledge, is that we've learned a lot. Part of the fatigue we're all feeling now and the stress is a result of having to learn new things all at the same time building them. So we didn't know anything about the virus. We didn't know how to operationalize these things. So the good news is, as tired as we all are from the work, we also can take some condition and support from or solace in the fact that we now have learned some things, and it's really up to us. I think it's up to all Vermonters, if not all citizens of the world, to act on what we know. So we can manage this virus short of having a vaccine to a certain extent if we are all disciplined in our behavior and follow the basic steps of mitigation. To what extent we can continue to do that, as we're starting to see now, there's a lot of what we call COVID fatigue settling in, and people, are struggling maintaining that discipline. I knock on wood, Vermonters are doing pretty well in that regard, but we are seeing, those cases increase at this moment. But that isn't sort of a linear progression. I mean, those cases can easily diminish if people fall back on following the mitigation strategies. So at any rate, I think we're in this phase now of trying to focus. I mean, certainly the precondition here is to continue to operate schools safely. Don't get me wrong, that's sort of a precondition, and it's job number one. But we also need to stretch ourselves to start thinking about how to begin to address the educational needs of our kids. The good news is we're doing that every day right now. I mean, just by the good work of all Vermont educators, every day schools open. even if it's remote, we're seeking to meet that need. And I observe from many students that they take a great deal of comfort in the fact that those routines, albeit they're different routines, those routines being restored has done a lot to bring stability to our kids and their families. But we have our work cut out for us. And I think, the good news is, once again, we know how to do some things, and we just need to be patient and apply those in a disciplined way. But my prediction is we're going to be in this phase through the rest of the school year. I think, we will still have some new information from science. We'll have new testing and treatment capabilities, and certainly the very welcome news of vaccines, plural, will be coming, no doubt, shortly. But my interpretation of the health information that I consume is that we should plan to be in this disposition for the rest of the school year, at least. So even when vaccines are introduced, it's unlikely that their sudden announcement would result in us removing our masks and removing the layers of mitigation that have kept us safe. We'll be watching that very carefully, and we'll welcome the opportunity to plan for that. But it's not going to be a sudden transition. It's one, I think, from a planning perspective, we do well to just accept we are going to be in this phase for a prolonged period of time. Certainly, job number one is to get through the winter and get through flu season. And as we move more indoors, that there's important considerations, and certainly we have to become even more disciplined, I think, in some of the mitigation strategies that we've employed to date. So I think, that's kind of where we're heading in the near term. I'll talk specifically about the guidance a bit that's about to come out, and then I think I'll pause and open it up to questions. So, once again, the revision process of the guidance, we have this task force that was created. Some of you, I know Soph's been working with that, and some of the superintendents on the call as well. The guidance, the original publication of the guidance was in June. And then we did a revision early August as people worked through a series of implementation challenges around that. We got feedback on it. So it's very much, I would say, firstly, not only focused in the health information, but informed by the iterative work of people trying to implement it. And that revision we did in August was really almost exclusively based somewhat on new health information, but largely based on the practical aspects of people implementing the original draft. Around that time, I observed that it would probably be prudent for us to do a revision to the guidance once a month, or at least to have a conversation about should we open that process. And we didn't do anything immediately because we really wanted to reopen schools, and we didn't think, unless there was some compelling new scientific discovery that would warrant us to make an immediate change, or perhaps a change in our conditions that would warrant some sort of pivot. We didn't think it was necessary, so we let it settle through the month of September. But as we got towards the closer to the end of September, particularly as we were, we had already sort of messaged that we would make a move to step 3 if everything held together, and it did. That we would reconvene the task force at some point early October, end of September, and that's exactly what we did. So the task force is certainly, I think this time around, my observation, certainly we have new health information. Particularly, I think more, I'll say consolidation or solidification around the distancing, which was kind of a new thing in August, particularly around, back in August, we were looking at the distinguishing features or the distinction between younger students and older students. I think that's more solidly represented in the revision that's about to come out. And I think, the issue about cold weather, we're starting to address that a little more emphatically, and no doubt we'll have additional guidance on that. Music was a huge challenge and remains a huge challenge for us. The science doesn't really point to a safe way to do music inside, particularly singing and wind instruments. So we tried, trying to work with some of these tough issues as best we could. But at any rate, I think you'll be pleased. Once again, the guidance is longer. It also includes a lot of information it's not so much new regulation, but new resources or pointing to existing resources and trying to bring those things all together. As of this morning, the guidance has more or less been finalized. What I mean by that is once the task force brings forward the draft work, it goes through a final sort of vetting by Dr. Levine and myself, who we have the sort of, once again, the emergency order responsibility and authority to promulgate the guidance. So we ultimately have to sign off on it. We've done that as of this morning, so now it's moving through an editing / publication phase, which can take, some time. I expect that the guidance at the earliest could come out tomorrow afternoon, and probably next week, if not tomorrow. So at the press conference tomorrow, we've been doing education updates on Fridays. I'll be sort of going through, like I did here, sort of what are the substantive sort of bullets that are involved in the new guidance, and I'll be talking about them more directly, even though it probably won't be published until tomorrow afternoon at the earliest. So, why don't I pause there, and be happy to talk about other issues or related issues. But once again, thank you for the opportunity to have a direct conversation with the group.
You'd think after all this time I would know how to unmute. This first slide is actually a quote from Dr. Levine from Tuesday's press conference regarding COVID-like symptoms and illness in school. And it says, and take a hard line if you are not feeling well. Even a headache or a runny nose. Things you wouldn't think of as symptoms could be a sign of the virus. I say this based upon our EPI team's experience, multiple instances where people have continued their daily activities while symptomatic. This is why kids may be sent home from school and daycare, and why you should stay home from work if you have any mild symptoms. I think this was in a direct response from Dr. Levine, because there was a lot of question and concern about why are we sending kids home with a runny nose, and that was a discussion at one of the meetings with you as well, Dr. French. So, do you have any thoughts on that you'd like to share?
Yeah, I think, it's a fair question, I guess, if we weren't in an unprecedented pandemic of a respiratory nature. So I think that in that context, I think it's understandable why we need to be precautious, cautious. I think, I would use this as an opportunity to speak. I mean, you guys live in this world, but the layered nature of our guidance, and that, I think when the guidance was first promulgated, I would get questions like, oh, so you're expecting cases to actually occur in school, or like a gotcha kind of question. And the answer is yes, we expect cases to be in school. As I've often observed as an educational leader, schools are just merely reflections of their communities. So if issues exist in their communities, they will exist in the schools. And in many cases, schools are safer in the communities, but they're not walled gardens in that regard. So, in terms of a layered response, the first layer is to prevent the virus from entering into the operational perimeter of the school district, which is why we require the daily health check. It's not perfect, but the whole idea of these layers, as imperfect as they all are together, they do increase our safety. So this idea of having a strong sort of consideration before staff or students enter the operational perimeters is a perfect one. And we know full well that, as Dr. Levine cites, people sometimes don't follow this closely or don't think they have a significant issue. And that's why we have the other steps behind this, which, I'd say, and then the second layer of response is okay, there's a chance that the virus might be inside the school. How do we prevent it from spreading inside the school, which is why we have the distancing, the masks, and the disinfection, and so forth. And then we speak about a layered response. Okay, what happens when someone does become symptomatic? How do you manage that in the course of your day, and so forth? So, I would agree. It's sometimes, out of context, you're sending kids home with runny noses, but in the context of COVID, in particular, one of the things I think I'd make the observation, I think we missed originally because we were so focused on those layers. And our greatest point of vulnerability, I think, is becoming obvious, that it's the travel that parents and families are involved in, and community members, right? So those aren't necessarily variables we control, but those are ones we can try to influence. And you know, this sort of idea of the perimeter, of the operational perimeter of the school district, is based on an understanding of compliance in communities. And when we see outbreaks regionally happening, or when we hear of instances of non-compliance, it just puts further emphasis on why we need to have a disciplined approach for our mitigation strategies inside the building.
Another statement following on that from Dr. Levine. Here we have you here to speak to us, and we're quoting Dr. Levine.
That's great. I'm enjoying this.
I know the two of you work very closely together. So as we start to head into the holiday season, I am asking us all to join together, to take a moment to recenter, to step back from pandemic fatigue, and rededicate to doing everything you can to keep the virus from spreading. Think carefully about travel, and know that if you do, you will most likely have to quarantine upon your return. Is the next slide about holiday travel specifically, Clayton? Okay. So here's where you get to weigh on, Dr. French.
Yeah.
Will there be any action by the Agency of Education to implement a 2-week period of remote learning following every vacation break in the school calendar, to allow for a full quarantine period after some of the school population has traveled in that vacation time?
Yeah, no, this is a great question. It's probably the most, I think, important issue in front of us right now, one of them that I detect in the school community. I'd respond to it a couple ways. One is there's a lot of rumors flying around that aren't necessarily coming from anyone, because the conversations aren't happening. You know, so I've heard, you know, are you going to shut down schools through February? I mean, that's not necessarily being contemplated. I say not necessarily because, you know, the governor would like to say everything's on the table, right? So, and one takeaway you should have is that we won't hesitate to take action. I mean, I think we've demonstrated that over and over. I mean, we were very aggressive in closing schools in March, when many of sister states were saying we'll close for 3 weeks and maybe we'll come back in April vacation. I mean, one of the ingredients of our success is not being afraid to make tough decisions when we need to make them. So the decision around this will be like the sort of decision pattern we've had all along, will be based on the information that we're provided, but also in anticipation of what's necessary, because, you know, part of the dynamic in this pandemic is there's a lead lag between some of the variables, you know, so we know cases today will become hospitalizations tomorrow, which, you know, could result in more serious injury. So we have to be, and I think another point is just being really open to keeping an eye out for what's happening around us. You know, it's not so much looking at Vermont. It's, as a tourist state, we have to be very cognizant of the travel patterns that are happening in our region and the contagion patterns that are happening in our region. So we're not settled on anything, but nothing's off the table. But in terms of specific, you know, I'm saying the rumors, if you will, I don't, you know, those aren't coming from our decision-making process. I will say, you know, the immediate decision in front of us is Thanksgiving. So part of this question speaks about a pattern, you know, like if we do something at Thanksgiving, will we do this in February? We'll do this in April. You know, that's really, I don't think, a good context for or framing of the question, because, you know, the conditions in February will be totally different. I guarantee you they'll be totally different than they are in Thanksgiving. So we have an immediate issue in front of us around Thanksgiving. And I'll respond specifically or directly to this question by saying we are actively reviewing doing something from the state level. This question speaks about action by the AoE, but we are actively reviewing and asking the question, should there be state level guidance for the Thanksgiving holiday? So we're actively reviewing that. I think to give you further understanding of that, I'll describe some of the variables we're looking at as part of that evaluation. You know, one is certainly an appreciation of the context, the regional context, what's going on around us. So we know Thanksgiving people will travel, and certainly to Dr. Levine's previous quote, we are encouraging people to really think hard about doing that. And that's, you know, it's not an us versus them. It's not about saying school people are safe and everyone else is unsafe, because we have school staff that are equally, you know, need to be reminded about following precautions as well. It's, you know, so I think, you know, we need to sort of take a pause and really evaluate, you know, our travel plans for the holiday, and particularly, I would say on the other side of that, people come visiting us. You know, we need to individually have that sort of introspection moment and take a look at it. So we're contemplating, you know, one of the variables is some sort of understanding of the context that we're in right now. I think secondly, looking at, I'll call it operational fatigue, a little maybe nuance from the COVID fatigue. I think COVID fatigue more broadly pertains to our ability as a society, not just Vermont, but as a national society and maybe international society, to maintain a disciplined approach to the mitigation strategies. I mean, it just has weared on us to a certain point. And we see that in people wanting the need to get out, to go out to eat, to celebrate, to meet with friends and so forth. So the distinction, I would say, operational fatigue is really just based on our understanding of the Vermont school system and what we've asked it to do essentially nonstop since March. So we know there's, you know, when I speak to the food service directors, you know, those programs have been running nonstop, doing things they were never designed to do. No point of decompression, you know, over 30 waivers of regulation. I mean, it's been nonstop. And that I could extrapolate that out to other operational areas, your area, the nursing area, of what you've had to engage in to manage the emergency phase, how to engage in the planning phase, everything you've been called upon to do to maintain operations. I could just go on and on. And based on our observation, we know people are at a fatigue moment in the emergency response. So we have to think about how does that translate in terms of vacation and Thanksgiving and the normal sort of, once again, conditioned response to celebrate, to take some time off, decompress, relax. So that's an important consideration if our goal is to have continual operations in school districts. So there's going to need to be times to take a break. That factored a lot into our decision making for April vacation last year. You know, we kind of knew people just needed a moment to prepare for the haul in front of them. And I think lastly, another variable is some of the new technologies that are occurring around us now. And I would throw into that the presidential election is sort of a dynamic, but you know, vaccines and the antigen testing, particularly the Abbott Binax Now test that we've been received, and contemplating how we're going to implement some of these technologies in the coming weeks. At the same time, we're all heading indoors for the colder weather, flu season's upon us. So, you know, how all that comes together from a science standpoint, I think, is another in consideration. So all those variables come together, and I think provoke a need for us to have an elevated decision-making process around Thanksgiving, which we are now engaged in. So,
thank you. When our schools are short-staffed to begin with, and then we add in daily tasks to maintain COVID precautions, it appears the safety of teachers and students are at risk. What supports or added guidance can the Agency of Education offer to increase safety in our buildings so administration and teachers may maintain a space where staff and students are healthy, safe, and ready to learn?
Yeah, I think it's a great question. And for me, it speaks to the sort of operational awareness and the need to have continuous operations that by design we were trying to achieve in our guidance. I think, you know, we've received some criticism in our approach in that we had to impart some flexibility to school districts, largely based on these considerations. I'll call these operational variables that vary. You know, school districts, unfortunately or fortunately across the state, have huge differences in their ability to operate during this pandemic, and if not regularly. So, it's firstly important to acknowledge that as a state, we have significant demographic challenges before the emergency started. And I would argue the emergency has exacerbated some of those challenges in terms of the availability of staff in key critical areas, say nursing shortages, subs, you name it. But part of our response here in terms of guidance was to acknowledge that right from the beginning and say, all right, as much as we would rather have a consistent approach, we're going to make the health guidance the cornerstone, and there's no compromise on that. There's no way to say some districts can be safer than others. We have to insist on every Vermont student and every staff member being safe. But we had to build in a way to acknowledge that firstly, there's going to be changes in the conditions that might be different in Burlington versus Canaan. But also that the operational variables that this describes, particularly staffing, vary greatly as well. So that's our response and guidance, was to allow districts the flexibility on deciding in-person, remote, or the combination of the two, which is hybrid learning. And that's, the criticism we've received on that is that, well, it's all over the place. And absolutely, once again, some of these things being all over the place existed prior to the emergency, maybe weren't visible to people, but for those of us who administer the system, they were acutely on our awareness. And I think what we've done through our guidance is to give districts some flexibility to navigate these changes. And that once again, the health guidance is non-negotiable, but we give them some flexibility. And so, for example, where districts I'll use some of the old schools I worked in where they didn't have a dedicated cafeteria. I know Mandy Mayer's on the phone. Her school, by design, is a new school, relatively speaking, has no cafeteria by design. The idea was to feed kids in their classrooms by design. It's a new building. It's kind of unusual in that regard. But many cases where I was a principal or a superintendent, we had schools that had cafetoriums. I know you're all familiar with that phenomenon where the gym is the cafeteria, and it's also the stage, and it's also used for classroom experiences. So to think about, and that was when I talk about these things, at a press conference, they're revelatory for many Vermonters who aren't familiar with our rural schools, but that's sort of what we have. To think about a single set of guidance that would work in that context versus a school district that had multiple gymnasiums, in a school, or large cafeterias and so forth. So, districts have different resources available to them. So to what extent a school district was using an MPR, if you will, or a cafetorium as a way to hold classes because their classrooms weren't big enough to accommodate the distancing requirements, versus school districts that had plenty of space. And all those variables impact a decision's ability around hybrid learning or not. So districts that couldn't conform to the space guidances had to shift to remote learning sooner rather than others. And those things are all very real operational considerations. And our response has been to impart that flexibility. So that was sort of our first take on it. I think going forward, the need to maintain staff is one of these once again, these considerations. It's one thing to open schools safely. It's another thing to keep them open safely. And this is the wear and tear piece, and maybe speaks to some of the concern around Thanksgiving. We're going to have wear and tear, if you will, on the people side of the business. And 80% of what we do is a humanistic endeavor that involves people. So we need to acknowledge that right up front, that pretty much everything we do is dependent on staff, and rightfully so, because it is a humanistic endeavor. But we are looking at things like, well, how do we, help districts with substitutes? Is there flexibility we can do around licensing? We were able to get a waiver on the online teaching endorsement, things like that. But there's no magic answer here other than to give people some flexibility and some tactical discretion to make decisions as conditions change.
Thank you. With conversations happening at the state level around specific holiday guidance, we start developing our own at the district level.
Yeah, I think once again, there might be, when I think about Thanksgiving, again, I'm not going to speak broadly about holiday because I don't think we're that far down the road. I would say as a caveat to that, I did start a conversation at the end of the spring about to what extent should the state be in charge of managing the school calendar this year. And there wasn't much interest in that topic. So I think, we have under the law, superintendent regions establish a uniform school calendar of at least a minimum number of days. As you might be aware, the legislature did modify the minimum number of student days. But we're actively considering Thanksgiving. I would give that a week or so before a district adopts its own disposition towards that. Because I think we will, if we are going to promulgate something at the state level, it should settle off prior to Veterans Day, I would argue.
Thank you. How is the AoE guiding superintendents and principals around the issue of short staffing due to staff absences related to illness or travel quarantine?
Yeah, we don't have a significant role in this area other than our guidance does speak. It parallels essentially the CDC guidance on, the people that are more vulnerable or at risk. And here too, I think our flexibility around the hybrid learning allowed some districts to provision staff who are otherwise unavailable to work in person to provide them an opportunity to work online because they were deemed more vulnerable. But there's a line of demarcation. The agency does not get involved in sort of the employer-employee relationship and in terms of administering federal and state employment law. That's really a local aspect and local consideration. Based on my experience, particularly when you get into making what are called accommodations for employees, you might be familiar with Section 504. Those things require a consideration of the specific work environment and the job assignment of the employee. So there's not a whole lot for us to do in that regard, other than to convene conversations of expertise if people had a specific legal question. But we don't generally get involved in specific employer-employment relationships.
Thank you. What is the percentage of adult to student ratio that must be maintained for safety or deciding when a school should go to remote for the day instead of in person?
Yeah, we don't have such a ratio, and I'd be resistant or hesitant to create one. I think it's a function of the conditions and the environment. I can see different ratios working better in certain environments than others. And I think this gets back to sort of the tactical discretion piece, where districts, it's like how many, if I were to pose the question, what's the best ratio to supervise a playground? I would say, firstly, how big's the playground? How many kids are going to be at the playground at once? What equipment do you have on the playground? To what extent do you have visibility into all aspects of the area? So those are the things I would utilize to compute how many adults I should have supervising a playground. And I don't think we have a clear view of what ratio would be broadly applicable, because the specific environments have to be considered, and there's no way we could do that necessarily from a state perspective.
Thank you. How can we afford to loosen up restrictions when the infection numbers are rising all around us?
Yeah, I don't think we can. And I think what you'll find in the revised guidance is not a loosening, but almost a calcification of the guidance. I mean, I wouldn't say becoming more stringent, but becoming more, just, I would say clear, I don't think we can afford to loosen up our mitigation strategies at this point. I would make the layman's observation that, in places where we are seeing outbreaks, perhaps those restrictions are too loose, or they've lost some of that discipline. But that's probably unfair because this virus is out there and can occur in any situation. But I don't think we can afford to loosen up. And I think there's certainly a direct cause and effect for when steps aren't followed. We can almost anticipate, that there's going to be an outbreak. So we can't afford to loosen up. I will, maybe the question's also asking about, I'll use sports as an example. It comes up sometimes where we have to evaluate each activity separately. So we have fall sports guidance that's already been promulgated, and we're about to promulgate winter sports guidance. And I think both sets of guidance follow a pattern where there's general guidance for all fall sports, but then there's a specific analysis of each sport, and draw the distinction between football versus cross country running. From a COVID-19 perspective, they're fundamentally different activities, different proximity to individuals, different exertion levels, and so forth, perhaps. So the guidance for each of those sports is fundamentally different. And we have to do sort of that level of analysis for winter sports as well. It's argued to be much more challenging, in that we're going to be indoors for the most part. So, we, on the one hand, just to walk through a little bit how I think that decision making works, we start with the assumption that these activities are valuable to students, and I think that's important to acknowledge that these activities are not extras, just like music. These are critical, probably more critical now in the context of a pandemic where there's so much uncertainty in the lives of our students. So we start with the assumption of, obviously, this activity is important, not only for education, but also for the mental health of students. So then we walk through a process of evaluating, well, what are the risks involved from a COVID perspective? And then what mitigation steps could we employ to lower those risks to a point where we're comfortable? And that sort of process doesn't always end up with us saying, we can offer the activity. Sometimes we're like, the risks are high, we can't find any way to mitigate the risks. Therefore, this is the conclusion. I would say in terms of winter sports, wrestling is an example of one that we'd say wrestling's critically important. There's risks involved with the close, proximity of the wrestlers. There's no way to get around that. How can we mitigate it? Can't really do it to a point, where we're feeling comfortable about it. So, we end up sort of drawing a conclusion that we're in a limited position relative to wrestling. So that's kind of maybe what the question's asking, is how do we go through that and that analysis? But it's certainly, the broad conclusion, we're not loosening up restrictions anytime soon. And I would argue, once again, to say that even when a vaccine is introduced, or vaccines, we're not going to see an immediate loosening of restrictions either.
Thank you. Along that line, it's
Yeah.
an observation that some private sports clubs are conducting interstate travel for games on the weekend, but are advising their players to disregard the state quarantine guidelines. Is there a way to require that those who participate in such high-risk travel through sports clubs to be 100% remote learners, making families choose between in-person learning or traveling for sports clubs?
Yeah, it's an interesting idea. I think it does beg the question as to what extent we can enforce certain things or get compliance. And I think we've found we can get better compliance through education than we can with citing someone for a ticket, if you will. But this is a challenging topic, and I think it to my earlier comment about travel being our greatest vulnerability. One of the things I've observed, and once again, I'm not a medical expert. I've certainly learned a lot in the last 8 months or so. But one of the things I've observed about the hockey, in particular with Central Vermont, is that this is a very complex activity from an epidemiological standpoint. It's not similar necessarily to cases in a school where we can go in and, because of the structure of pods, of distancing and taking attendance and just the physical boundaries and regulatory boundaries around the school, we're able to get into that pretty easily from an epidemiological standpoint and do contact tracing down to its conclusions. The hockey league issue has been interesting to observe from a system standpoint, because I think it's a much more complex system, and that's why it's proven more challenging for us. It's certainly, as you can imagine, on a two-dimensional plane. It's students from multiple school districts coming together in an activity. So you have that dimension, and you could expand that out to also say that these are interstate leagues of school districts coming across from different school districts. But then we add in, there's something perhaps about hockey and the virus, where we saw a study, a very brief study out of Florida about, there's something about the plexiglass around the rink and the exertion that's going on. Maybe there's something going on with hockey itself. But then you have the adult components as well. So we have students coming to these things. We have adults playing in the same facilities. We have post activity recreation happening, social activities, I think you've heard mentioned. So this quickly becomes, I mean, someone's observed it's like one of the wedding events, you know, where we have people coming together. And then I think I would add on to that, say it's like having multiple wedding events at the same location with people coming from other states, and then having receptions in different locations and trying to pull it apart. So it presents a significant challenge, I think, from a complexity standpoint. And it's one, you know, I think I think all the northern New England states in particular, we've all been adversely affected by this. And, you know, New Hampshire shut down their activity, and I think Maine's really taking a close look at it as well. And I don't want to pin it on hockey per se, but if we just sort of step away from this to say, firstly, lesson learned, we have to have a synchronization between our school policy on sports and our recreation. I mean, these things need to be tightly integrated. To our credit, I think we've done that as a state, probably better than some of our neighbors. And I would say some states, you know, I would say my colleague in Maine would observe that they have no regulatory control over sports at all, you know, that their equivalent of the VPA has created its own regulations. And they don't therefore have any control of the recreational sports as well. So there's a disconnect. We've at least bring them together in a connection. But the question is how to get better compliance and to surface the significance of those activities. And, you know, that I think led to the governor putting a temporary hold on rink reservations late last Friday. But I think, you know, this question, I don't know if I necessarily would agree with, you know, getting into sort of that tight of a carrot and stick relationship and making kids and families choose between one academic thing versus a sport thing. But I think it's pretty clear that we have a complex activity on our hand, and this will become more complex in winter months when these activities are indoors. And secondly, I think it just reinforces why our guidances need to be in synchronization with each other, that we can't, it's like squeezing the tube of toothpaste, you know, we can't have stringent requirements in one location and then allow less stringent requirements in another setting. So that all people do is move from one activity to the other. So I appreciate the constructive thought, but you'll have to think about it, I guess, some more.
Thank you. Is there a way that the AoE, VDH, and ACCD could work jointly to mandate any high-risk travel these private clubs are participating in to adhere to the interstate travel guidelines?
Yeah, I think we have the regulatory framework in place. I mean, we do coordinate, and there's an exceptional amount of coordination between AoE, VDH, and ACCD. I mean, largely for a couple of reasons. One is we work together as a team by structure, but also we've put the health department in a leadership role. So really, none of these agencies would create guidance without really the health being sort of the cornerstone of it. But the question here, I think, is back to a compliance issue, perhaps. You know, I think we've already mandated certain requirements. The question is, are people following them or not? And I think we can say that maybe with sort of the COVID fatigue, we're not necessarily seeing as much compliance as we would like. I think we've also been through a pretty significant travel time of the year where we've had a lot of visitors to Vermont. So it's important to acknowledge that as well. And I think it's part of this. To me, it points to, I think we already have the regulation in place. It's a question of education and communication. And I don't think we should underestimate the importance of those things, to remind people that there's real consequences here for their actions. And if they have for my selfish disposition of running school systems, if we are sincerely interested in keeping our schools open, then it's going to require everyone to do what's necessary. And that means, you know, look very carefully at your travel.
Thank you. School nurses need to know the AoE is supporting the guideline, endorsing the school nurse COVID coordinators as the healthcare experts that they are. What consequences or processes have been put into place to ensure schools are doing their best to maintain distance and not just packing students in had less than 3-foot barriers? And who's going to keep the schools, superintendents, task force committees of larger districts in check?
Yeah, and I would put even smaller districts on that too. I don't know if I'd draw the distinguishing feature, but yeah, and I think we're certainly, and Soph, to her credit, has raised this pretty consistently with us as a group on our Friday meetings, and she's not the first to raise it, but it is a challenge to a certain extent. The good news is we do, the guidance has the force of regulation. So when I say good news is that all licensed educators, as a condition of their license, are required to follow the law and regulation. So the bottom line is we could make this a licensing issue if we had to, So I would certainly, try to reinforce that with all leaders that this is non-negotiable to a certain extent. This is regulation. We certainly are. When I say to a certain extent, we're open to making the regulations better, and certainly to one of the reasons they've been successful is we've relied a lot on feedback. But at some point, we have to just turn to implementation and fidelity with implementation. And so I would say 2 parallel tracks on this. One is, I would say, internally in a responsive system, let's assume that people are interested in the feedback, like from a nurse saying, you're not following the guidance. Oh, I'm sorry, we need to address that issue, kind of thing. And being proactive about educating people about what's in the guidance and what is not in the guidance. I would like to think at this point, and certainly what factored into our decision making to move from step 2 to step 3 is that we believe people had a certain amount of fluency with the guidance at that point. So it really wasn't about, oh, what's on this page? It was more about how do we operationalize what's on this page. So I think, continuing to do that at the local level, but then contemplating some escalation internally as well. So if it's a teacher not following the regulation, it should be, brought to the principal. If the principal's not following, it's the superintendent. And that's in a perfect world where people aren't fearful of retaliation or power, authority, things like that. But I think that's important to acknowledge there should be a local sort of enforcement of those things. And then, sort of on the nonlinear approach, I would encourage people to report those things to us. So we have a general support email, aoe.support@vermont.gov. We would be happy to assist. We see ourselves at the agency having sort of basically 3 core functions. One is leadership, but the other 2, support and oversight. From a support perspective, like I was mentioning locally, I think your first inclination would be to reach out and say, and we've done this, do you need any help complying with the guidance? We're here to help you translate it. If you need to brainstorm some solutions, we'd love to help you do that. The other side of our work on the oversight function is to say, you're not following the guidance and you need to start following the guidance. So we're happy to become involved in either one of those things.
Thank you. We have just a couple of minutes before 5 o'clock and lots more questions. I want to be mindful of your time though, Dr. French. If you have a few more minutes.
I do. Happy to continue.
Terrific, thank you.
Well, I didn't see the questions yet, so can I take that back? No, go ahead.
Thank you. Currently operating under a guidance that says as best as possible when it comes to implementing the science-based distancing at 3 to 6 feet. In terms of distancing, what advice would you give? It says expect. Expert, is that what it's supposed to be? School nurses to practice. I'm not sure. Let me try that again. What advice would you give to school nurses who are practicing evidence-based nursing and disease mitigation when we cannot maintain both 3 feet between students and have all kids K through 5 in the school classrooms? So I think this might be asking if the rooms are not big enough to keep distance and bring the kids in.
Yeah.
Go ahead.
Yeah, I think I understand the gist of it. I was distracted by the chat window and the questions popping up. So just to reinforce what I mentioned, our email is available as general support, but I think I saw in one note it says send all communications to the agency. So that, that isn't to imply that you don't have a local responsibility to resolve these issues. It was the situation in particular when you didn't think you could resolve it locally, then we're happy to become involved. But our expectation certainly is that professionals would work to implement the regulation and guidance. So this question, yeah, I think it's the first thing I'd say is wait till the new guidance comes out. So I think, I haven't settled on the right word to describe it, but I think there's a solidification around the distancing piece that, initially was a little squishier. I would say also, I should have mentioned, we've had this pattern of the guidance and then FAQs, or frequently asked questions, which have the same force of regulation. So one of the things that happens, I think, in the sort of revisions of guidance is that we've accumulated some FAQs since the August revision. And this is sort of one, I recognize some of the language here is from that FAQ on distancing. So what's going to happen with the new revision is the new revision is going to incorporate some of the FAQs. Because some of that, basically the idea of FAQs is sort of like incremental clarification. Now the new guidance will basically be a reset on some of the FAQs. So I would say, firstly, specifically on this question, pay close attention to the new guidance when it comes out, because I think we tried to get into this point in particular. And if we need to do further clarification on an interim basis, we'll seek to do that on an FAQ basis in the near term. But I think particularly as we get into the colder weather, some of these things are really becoming hardened in the guidance. So these are hard rules, and we really want to see closer adherence to them. And the idea of packing a classroom or disregarding the guidance is increasingly going to be unacceptable, frankly, and unsafe. So I think you'll find in this new guidance, I'll pause a direct answer to the question and say, wait till the new guidance comes out, take that up locally and see where it leaves you. I've had, people are going to have some hard time where they've legitimately tried to accommodate their spaces, but it's going to sort of be a reset on their problem solving, and they're just going to have to find a new way to operationalize the guidance. But what we're not going to do is compromise on the health standard. The flexibility occurs on the operational side. That's where we can speak to remote learning, in person, hybrid, and so forth. But the health guidance has to be very stable and consistent for all students. It's how it's going to be.
Thank you. I think sometimes I'm jumping before the next question. I think sometimes what comes up is the school nurse may be saying we have to have 3 feet between these students, and a teacher or the principal is saying, no, we don't need to do that. We're going to do it our way, which, as you can imagine, leads to a great deal of frustration. So, and as you know, there aren't a whole lot of schools that have more than one school nurse. So the school nurse is the only healthcare professional in the building with a bunch of educators who look at life differently than school nurses do. But what kind of support might those school nurses have besides throwing a tantrum and
well, yeah, I think, and once again, to our credit as a state, we are so fortunate to have sort of this flat chain of command, if you will. You have a tremendous resource of school nurses in the Department of Health. And I would say superintendents and everyone on this call. The Department of Health has been tremendously responsive to these kinds of situations. I've lost track of how many town halls Dr. Levine has done or Dr. Holmes. You should not hesitate to reach out to them to help, bring people together to interpret, the medical aspects of the guidance. They will, there's a point, I know, as we saw with the opening schools, people, especially in schools, we want a very definitive, clear, tell us what to do, and to a certain extent we can do that, but to a certain extent you need to apply this in your context and apply your best professional judgment, which you're all capable of doing. We can support you in that decision making, so do not hesitate to reach out to the Department of Health, and even for us for that matter, we'd be happy to help. But some of this gets into nitty gritty of this sort of question is how do you, or the question you're posing is how do you interpret the guidance based on your context, and the language and there's a lot of language now, it's 40 some odd pages. A lot of it's very specific with the use of the word should, recommend, you know, those aren't not unintentional choices of words, but we can help you interpret and apply them.
Thank you. Could we discuss a scenario where both a teacher and principal are creating difficulty? Sounds like it's hostility. A hostile work environment for the school nurse and COVID coordinator who is trying so hard just to have them follow the restart guidance from the AoE. Is there something we can do to support the nurse?
Yeah, I think, when certainly from the state level we can support, but this, if we just take COVID out of this, let's just, and I like the, let's use the word hostile because that's sort of compacts some meaning into everyone. What do you do when you're in a hostile work environment? What are your recourse? So we have labor, we have grievance issues, we have, general laws and regulation about harassment and so forth. So there's a whole bunch of traditional stuff that should be brought to bear to solve these things if they're not being resolved through a amiable or constructive process. So there's a whole bunch of things that'll come to play here. We're basically, our job would be to come in and to help facilitate that and to say, sometimes just an email or a call from the agency, helps people kind of get over the hump and sort of be more proactive. That isn't always the case. But I think, it's important to acknowledge that there's the normal sort of regulatory framework that ensures all people work in a productive work environment, and folks should leverage those tools as necessary.
Thank you. School districts across the state have instituted many different approaches to increase the time students are outdoors. Things like tents, stump circles, open fields, nature walks, etc. As the cold weather approaches, has the AoE considered additional guidance on how these outdoor opportunities are still viable? As an example, rented tents need to be dismantled and returned due to snow load concerns.
Yeah, we haven't necessarily provided, our guidance falls into generally two categories. One is sort of regulatory guidance, thou shalt do these things. And the other I'll call considerations guidance, like here's best practices, some things to think about. We haven't put out any regulatory guidance on outdoor classrooms other than to encourage their use as much as possible. And I think, the list here, stump circles and so forth, it just, it's a wonderful inventiveness that's occurred, and I would argue really positive outcome of this emergency. And hopefully we'll see more of that after the emergency is over, because it's one of our tremendous assets here in Vermont is to leverage our setting and place-based learning. But, specifically in terms of our regulatory approach, I think that this consideration really informs this next revision of the health guidance, because basically what it's saying is we'll probably be going to move inside, and we have to be more disciplined, and our approach to implementing our health precautions inside that environment. So we don't have any specific consideration guidance planned for outdoor activities, but typically our consideration, quote unquote, guidance comes from the field. So we would hear from districts doing things, sharing practices with us, and we'd say, hey, we'd be happy to turn that into guidance that we could share with everyone else in the state. So we generally don't have much to say on these kinds of things unless it comes from you all first. So we'd be happy to, if something emerges on igloos or whatever, we'd be happy to speak to it. But I think my takeaway immediately is that this issue is being represented in our move in the revised guidance that's about to be promulgated. In that, how do we consider, indoor learning more in a deliberate way?
Thank you. How is the AoE handling private schools who are not implementing current guidance?
Yeah, we've had these issues come up, very similar to using our email, but typically, like it would be in your school, most of the time, my inbox is flooded on a daily basis with, as is our help desk, with folks anonymously complaining about something, frankly, so, and I want to say complaining, but sharing their concern. And a lot of the patterns we see, particularly on independent schools, would come into that category because there's not necessarily the same regulatory construct. We still have a regulatory construct, but it's not the same with public schools. So an example, I'll get an email from a concerned citizen who was dropping their kid off at a private school and was concerned about kids not wearing their masks. So that would result in me or someone at the agency reaching out to the headmaster of that school and saying, look, we're hearing about this, what are you going to do about it? But they're still required to follow the guidance. When I say we don't have the same regulatory framework, we do have a construct of approval. So it could jeopardize their approval theoretically, but that's a more elaborate process. But we, in terms of the authority under the governor's emergency order, they have a direct responsibility to implement the guidance. So it's in that level, it's the same as the public school. So we're able to speak to them directly and say, you have to do this. It's not, oh, I'm an independent school and I don't have to do it. They have to do it. That applies to all schools in Vermont, including sectarian religious schools.
Thank you very much for clarifying that. Do we have time for one more question?
Sure, I do.
Okay. Your favorite and mine, Dr. French.
Yeah.
Screening and temperatures. Temperatures being taken at schools with infrared thermometers are not providing reliable readings. Can the AoE please advocate that temperature screening be done at home or as needed at school?
Yeah, this is, as Soph indicated, it's a challenge, quite a challenging topic, not as challenging as music. But just again, to give you a sense of our decision making. So we would take this kind of concern, and this is indicative of one we heard from lots of people about, and we bring it to the table as part of our decision-making process. And then we subject it to a series of criteria, so what is the value of temperature checking, from a scientific standpoint? To what extent is it valuable in terms of sort of getting people to comply, to elevate the concern on sort of that operational perimeter of schools, keeping that safe? We could say, well, it's a highly subjective measure, but the act of taking a temperature sort of signifies some importance to this. So anyway, we go through an elaborate decision-making process. Firstly, we conclude that we are not interested in abandoning temperature checks as a mechanism. So we think there's still some value. Once again, it's just part of a list of things, but it could be helpful. And so we're not interested in abandoning it. I think the second issue has to do with the cold weather. Yeah, absolutely. The infrared thermometers don't work so well at 20 below. Go figure, So this presents a real practical challenge that we have to figure out. And we don't have an easy solution for this. We're also, I should say, unwilling to let it be a voluntary process or let it, be done at home. That our practitioner group was opposed to that. We don't think we'd get as good compliance or a good data out of that. So it still resides in that sort of in between space where we acknowledge, firstly, it's important. It has some value. Its value might be in just getting people to comply, but we acknowledge it's problematic in our conditions in Vermont and northern New England in the wintertime. So we have to figure out how to do that. Don't necessarily have a perfect solution from the state coming down on how to do that, but we know people are finding ways to do it. And we certainly, as those patterns emerge, we'll probably be publishing some FAQ kind of, here's a good way to do this if you're encountering the issue, but it's not going to go away in this revision. To where we started today with Dr. Levine's quote about runny noses, any of our symptomology surveillance is important, particularly as we move inside. So it's hard to reconcile the fact that we have cases emerging all around us with any kind of approach that would loosen our or lessen our stringent requirements. So if anything, we should be heightening our awareness, not lessening it. So
thank you very much. And on behalf of the Vermont State School Nurses Association, I'm grateful for the time that you've shared with us and the answers and your committedness to the students and the people, all people, all ages. And
Well, thank you for the opportunity, and you know, I'd like to thank you all for your leadership. I know it's, and I use the word leadership in not necessarily, I don't sprinkle that around on everything I say, but I know once again the practical wisdom of nurses and the leadership you've brought. I've benefited that greatly throughout my career, and I know one of the critical reasons we've been successful in the last 6 months is because of you stepping up to the plate and doing what you had to do. So thank you very much. Hang in there. I'll be happy to come back again at some point and speak more directly on any other issues. So thank you for the opportunity.
thank you very, very much.